According to the CDC, in the 20-year period between 1999 and 2018, we have seen a 26% drop in cancer death rates. So, what's making the critical difference? Well, one major factor is cancer screenings. And while early detection is key, what does that look like amidst the global pandemic we're all facing right now? Well, joining us this morning is Dr. Genevieve Morange, a hematologist and oncologist with Ochsner Medical Center, North Shore. She is here to help us answer that question. Good morning, essential worker.
Good morning. Hi.
Thanks so much for joining us this morning to talk about this very important topic. First things first, let's talk about some of the trends that you're seeing in the medical field when it comes to these cancer screenings. What are you seeing?
So, one way that we've been able to identify a trend is by using our electronic medical record and gathering some data points to try to see where we may have gaps in care. And so, they looked at appointments made for cancer screenings in regards to colon cancer, breast cancer, and cervical cancer in March, as an example, and looking at the time period of March compared to the 3 years prior to that. And we know that there was at least a 10 to 15% decrease in appointments at that time. So even though that's a small data point, that kind of gives us an idea of what kind of gaps in care are happening. And then we're seeing that in our own practice as patients are presenting later than we would expect for complaints that they may have had for a period of months, but they were concerned about leaving their home.
It's really interesting because there are cancer screenings that people need to be getting. Let's talk about some of those. First, let's start with breast cancer. October is Breast Cancer Awareness Month.
Yes, very important. So for breast cancer, we recommend mammograms for women starting at the age of 40, but we know that some women may benefit from an MRI and a mammogram, so that's important to talk about with your healthcare provider.
The next one we're seeing here is cervical cancer. When should we get that routine screening?
Correct. So cervical cancer screening is a pap smear for women, recommended to start at the age of 18. And after 3 annual pap smears that are normal, you can push that back to a 3 year interval.
And notice that these are different procedures that need to be done because they detect two different types of cancer. Moving on to something that both men and women can, face, colon cancer. When should we get that screening?
Yeah, so colon cancer screening is recommended to start at the age of 50, and then every 10 years after that to continue with colonoscopies, which is the colon cancer screening method that's recommended. But for some patients, it could be critical to receive a colonoscopy earlier than 50. So sometimes they are indicated in your 40s or even your late 30s, and this depends on your personal medical history and your family history. So this is something to talk to your healthcare provider about.
And lung cancer?
So for lung cancer, we now have what you call a low dose CAT scan of the chest to screen for lung cancer in patients that are higher risk. And this is specifically for age 55 to 80, a patient that has smoked approximately a pack of cigarettes per day for 30 years. And if they're a current smoker or if they've quit in the last 15 years, then we know that they're at higher risk and they would benefit from that procedure.
Now, this next one is one I did not know is a common cancer screening. Skin cancer. When do we need to start getting that screening?
Yeah, absolutely. So skin cancer screenings should start at the age of 18, and then this should really be at the discretion of your doctor and having a conversation with them about how often, how frequent, based on your risk factors.
18 years old?
Yes, absolutely.
Wow. That's something I need to look into as well. And I know as a male, this is something I also need to look into coming up in a couple of decades. Prostate cancer. Tell us a little bit about that screening.
Yes, so prostate cancer screening is recommended for men beginning at age 40 to 50, and there are different screening modalities. So that's another good conversation to have with your physician about what screening modality is best for you and what age you should start, and that's based on your family history and your medical history.
And I think it's also important to note that these are cancer screenings we need to be getting, regardless if we feel healthy or not, because these are preventative measures to check to see. Because if it goes unnoticed, then it can become something much worse. So it's important to get those screenings. Very, very important, especially the skin cancer one. My goodness, I've never gotten one before. But I know for a lot of people, some people are getting afraid to go out right now because of this pandemic, especially going to the hospital. But at Ochsner, you all have some safety measures in place so that patients are taken care of, correct?
Yes, correct. So they have implemented a safe to return process at Ochsner. So this includes very rigorous sanitizing and cleaning, even more so than before, of all areas that a patient comes into contact with. The waiting room has been reconfigured for safety. They implement social distancing. They screen you at the door for symptoms. Of course, make sure we're wearing a mask. And then tools like receiving a text message or a phone call in your car in the parking lot, so that the second your doctor's ready for you, then you can come in the building to decrease exposures. So they've really made a lot of changes in order for everyone to feel safe to return to the doctor.
Very great, Doctor. Thank you so much for joining us this morning. Congratulations on the expansion of the North Shore Ochsner. Cannot wait to see what it looks like. And hey, here's the good news, friends. If you would like to support Ochsner, there are two ways to do it. You can enlist in their text to give program by texting the word Ochsner to 243-725, or buy a ticket to the virtual gala, the Moonlights and Miracles Gala, coming up on November 1st. You will be entered into the raffle to get a Mercedes Benz GLB. You can get a car. For more information about that, just visit ochsner.org/moonlight. All right, friends, get those screenings. And for more information about cancer screenings, you can log on to ochsner.org/cancer-care.